Well, I'm not a statistician, but I play one on TV. Hi, I'm Scott Ott, and this episode of Right Angle is brought to you by the members at BillWhittle.com. I'm with Stephen Green and Bill Whittle. And gentlemen, I have assiduously avoided going to Johns Hopkins website or the CDC website because A, it's a lot of numbers and I don't math well. And B, I just didn't think it would be very encouraging, and so I tried to avoid it. And this episode, frankly, is not some sort of deep analysis, at least not on my part. I'm sure Bill and Steve will ruin it by being intelligent. But I happened to stumble upon a chart, and I'm looking at it on my computer here from the CDC website under daily updates of totals by week and state, provisional death counts for coronavirus disease, okay? And there are a number of columns in this, but the first column in the table has a number at the top. And these provisional death counts simply means that the CDC doesn't have all the documentation on everything yet. It takes anywhere from a week to 8 weeks at worst to get the death certificates into the CDC and to make sure that they're correlated with the stats. But at this point in time, as we record this on July 21st, 2020, it's showing a total death count of 129,000. So they're running behind the official death count by about 10 or 12,000, okay? So as you read through the chart of this, the column shows week by week how many people died that week. In the week of April 18th, 2020, Steve Green, some 16,943 COVID-19 deaths are recorded, a horrifying number, out of a total of deaths from all causes of about 78,500. But what I noticed was after April 18th, the numbers started to decline. And they declined rather steadily. It went from 17,000 down to 15 something, then 13, then 11, then 9, then 7, then 5. And I don't want to go too much further because now you're starting to get within that 1 to 8 week window of time when they're still bringing the stats in. But in any case, it's clearly showing a trend that week after week, fewer people are dying of this disease. Now, Steve, the whole reason why I'm doing this show is because I haven't ever heard that on the news. all I hear on the news is, and they always show this cumulative chart where they show how many people died, and the chart seems to go up, 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 up. And of course, the cumulative chart is going up because more people are dying every day, but it doesn't mean that more people died this week than died last week. Does that make any sense? Am I making too much of this?
Here's the thing. Once you're dead, you stay that way, with only one exception in history that I can think of. And so a running total isn't very useful because none of the people that have died are coming back. So that running total where the chart just goes up and up, well, of course the chart goes up. We have a pandemic here and it kills people. So yes, that line is going, that curve is going to keep going up. What's important is the death rate, whether you measure that in death per thousands or death per 100,000s or deaths per millions. And that's declining, and it's declining in a big way. I saw figures, and these, you talk about out-of-date numbers. This has got to be 3-4 weeks ago now, where the CDC admitted that the actual number of people infected by COVID-19 might actually be as many as 20 million. Hell, it could be as high as 50 million, which would be, more than 1 out of 7 Americans, which would be absolutely huge. So what we're finding out is that as the most vulnerable are getting sick, and unfortunately some of them are dying, the people who are getting sick now, many of them, probably the vast majority of them, don't even know that they have been sick, that they've caught this coronavirus, that they've had the COVID-19 infection. And so the death rate is becoming minuscule. I ran the numbers a couple of weeks ago, and if you take New York, New Jersey, and Pennsylvania out of our figures, which represent about 1 in 10 Americans, the remaining 90% are suffering from what is a really bad flu season. A typical flu season might be 20 to 40,000, a bad one, 60,000 die, a really bad one, 70,000 or more. And that's what we have, is a super bad flu season. And this is good news. We bent the curve. I don't know. Remember the olden times of yore when the idea was to bend the curve? Does anybody remember that? Yeah.
2 weeks to bend the curve, I remember.
Exactly. The thing about it was you didn't want to overwhelm the hospitals. So instead of having this curve that is huge on the left-hand side of the chart, you've got a much longer curve. It doesn't come up nearly as high, and you don't overwhelm our ability to deal with the number of sick people. But the thing that nobody seems to remember is the area underneath both curves is the same. The same number of people get infected and hopefully lead us to herd immunity. That seems to be where we're heading now. And this idea that we've got to shut everything down again, even though everything is going well, again, not good, but well in the sense that we flatten that curve, we're not overwhelmed, and we have better knowledge now on how to do the three things we need to do. This is it, and then I'll finish. You need to protect the vulnerable, which is what they did not do in New York City and Michigan and Pennsylvania and in New Jersey, where they stuck the infected in with the vulnerable. You take common sense precautions, wear a mask when that's the right thing to do. For example, if I'm going to see my in-laws this weekend, I'm going to spend this week wearing a mask because I don't want to infect my in-laws. They're in their 70s. And these are the things we need to do. Protect the vulnerable, take care of the sick, don't be a jerk. That's it.
Now, Bill Whittle, there's a map over at Johns Hopkins website, and I've heard a lot about this before, and frankly, just didn't go to it for the aforementioned reasons. And I go to the tab that shows the entire continental United States, and I go to the tab that says deaths. And it's one of those maps where the light areas mean very few, if anybody, died, and the dark areas mean that's where the concentration of deaths were. And if you look at this map, it almost looks like nobody died anywhere except in New York, New Jersey, Pennsylvania area, and most of the southwestern United States, not all the southwestern United States, but areas around New Mexico all the way over to California, where you are. But there are some hot spots throughout the country, but the vast majority of the country is this kind of pale yellow color indicating that nobody died there.
Right.
I'm not saying this to say that we should trivialize the death of any American or that we should go into another rant about how the government has seized power and is trying to get us to do things that we don't want to do. I guess, Bill, I just think every once in a while some public official would stand up and say, hey, ladies and gentlemen, good job. You're licking this thing. You're being successful at beating what is, at this point, an uncurable disease.
Which would have been nice once it became clear we were doing that, perhaps the middle of April. Certainly by the end of April, there was enough evidence on the ground to say we have really remarkably turned this thing around. Yeah. We didn't hear boo about it. And the reason we didn't hear boo about it was because during that time of the lockdown in California started on March 19th, they set a 30-day lockdown. And if they come out at the end of 30 days and say, my God, we not only flattened the curve, we cratered it. We had to send the hospital ships home out of New York and Los Angeles Harbor because they weren't being used, and on and on and on. Then people would have said, well, then it's time for us to slowly start coming out of this. And the politicians don't want us coming out of this. They like very, very much these emergency powers that allow them to do whatever they want to do on an absolutely arbitrary whim. It has been said during this pandemic that the death total is essentially the only unpolluted standard that we have because percentage of people who die is predicated on knowing how many people who have it and don't die. That's a testing issue. We don't have those numbers. But the number of people who actually die is a solid number. Unfortunately, as with many other countries in the world, there has been an enormous fight about whether or not a death is a death of COVID-19 or a death with COVID-19. And the pressure to make it a death with COVID-19 has been very high by forces in politics in order to create a higher number of deaths. The difference between dying of COVID-19 and with COVID-19 is if you are a healthy person and suddenly you get COVID-19 and you die, you've died of COVID-19. If you're a person with multiple life-threatening conditions and COVID-19 is there and either pushes you off the edge or maybe even didn't have any effect with your death, you just happen to test positive of it at the time that you died of your heart attack, that totally skews the numbers. And all of this is to say that this thing has never been handled either in a scientifically sound manner or in a particularly politically sound manner. It is a weapon, and it has been. It's a biological weapon, but it's a biological weapon that's been used by American politicians against the American people. The reason the death toll continues to fall, the actual deaths continue to fall, is that more and more people are becoming infected in the age groups that we have known from the very, very outset. Initial reports from China showed that I don't mean to be flip about this term again, but it's a picky eater, this virus, and it's a strange picky eater. Most viruses go after the very young who don't have any developed immune systems at all. This virus just pretends they're not even there. 0 to 10 years old, there's essentially none. 10 to 20, there's essentially none. 20 to 30, you begin to pick up a couple of stragglers. 30 to 40, a few more. And then it starts to double pretty much with every age group. And so Steve's right. We should be protecting the people who are vulnerable. And there are several little ways that they do this, Scott. And as you mentioned earlier, it is a mortal fear of mine that in trying to understand the boundaries of this disease and talking about specific cases, that people will think that I have no feelings for those specific cases, that I'm being flip about them, that I'm being lighthearted about them. I am not saying that at all, but I want to tell you a case of something I saw the other day that is one of those cases of me being trained to see what's in the frame and what's not in the frame. I have the deepest sympathy, I genuinely do, for the people that lost this person. But there was a People magazine on display for about a week or so, and it was a picture of a young man, heterosexual man, who was a Broadway actor, cut down at age 41 from COVID-19. They did not say whether or not he had pre-existing health conditions, but basically, young, healthy actor who was in this play died of COVID-19. And again, with the deepest sympathies to the family, the deepest honest sympathies to the family. From a sheer political point of view, I looked at this and I said, is that the best you can do? In other words, if you are going to go so far down the line, I had no idea who this guy was, but he was in a couple of Broadway plays. If you have to go that far down the celebrity food chain in terms of fame to come up with a healthy person who died in their 40s from COVID-19, that is evidence. If this thing were as deadly as they said, they would have had Tom Hanks at the list of those people, or they would have had Charlize Theron or somebody like that. If these people were dying at the rate that they want us to believe they were, we wouldn't have to go to somebody on the cover of Newsweek magazine and as an example of young, healthy people, famous, healthy people dying. Wouldn't have to go that far down to people who, if you haven't been a close attendant of Broadway shows, you would never have heard of. And that is evidence. It's kind of like the same kind of evidence that used to be the case when you would see movie reviews and it would say riveting on the billboard. And then you'd look for the attribution, and it wasn't the New York Times and it wasn't the Hollywood Reporter or Variety. It was the Poughkeepsie, the Poughkeepsie Post Messenger. And when you look at that, you say, if their best quote comes from a fourth-rate magazine or newspaper, then that means that there are no good quotes from the magazines that do this for a living. And when you train your eye to see things that way, you begin to understand how all of this stuff works. I did the numbers on this back at the end of May. They seem to be holding relatively steady. Of the top leading 10 causes of death, COVID-19 at the end of May had already surpassed 3 of them and was about to surpass 4. And I took a look at what the rates would be, and if the rates continued, it seemed to me that COVID-19 would be between the number 5 and the number 4 killer in America for 2020. It wouldn't pass heart disease, not a chance. Not a chance of passing cancer, not a chance of passing whichever the next one, which might have been accidents. But third or fourth leading cause of death is a significant cause of death. But they have never, ever, ever done what any responsible news agency would have done and said, to put this danger in perspective, since January 1st, 114,000 people have died of COVID-19. Since January 1st, 523,000 people have died of heart attacks, 419 have died of cancer, 312,000 have died of diabetes, and never put the disease relative to other causes of death to give a reasonable adult a sense of what the actual risk is compared to all of the other risks that we already deal with as part of our ambient risk assessment. We know when we leave the house that there's a chance we'll be killed in a car accident. There's a chance that kids will get shot up in school. We know that there's a chance that you're going to keel over if you have a donut. We know what these risks are. And there was never any effort to put COVID-19 into the spectrum of existing risks that we have to face. And somebody somewhere, and I'm disappointed that I haven't heard this from the president, needs to have the courage to come out and simply say, listen, 2020, these are the facts on the ground. There is now a new way to die in America, and it was not here before, and it will be with us forever. Vaccines may significantly, drastically reduce that number in a year. We hope that's the case, and we expect it will be. But there's now a new way to die. And we have to understand what that additional risk is, and we have to make adjustments in our lives in terms of the choices we make in terms of dealing with it. I would have then have gone on to say, while this is an alarming, disturbing trend, we have now this new many ways to die per year. These deaths per year from smallpox have been off the list for 50 years. This massive column compared to COVID-19, polio has been off the list for another 70 years. Yellow fever is off the list. Bubonic plague is off the list. Dropsy, whooping cough, all of it. Gone. They're gone. And now something new has been added. And life does not guarantee us a world where nothing bad happens to us. We need to understand what the scale of this risk is, accept that it's out there, and go on and get on with our lives, understanding in advance that we are going to take losses from this because it's here, and that is the reality of it. But to stop our entire society for this, and to put thousands and thousands of businesses and millions of people out of work, for something that has never been put into perspective for political reasons, is an enormous, catastrophic failure of the press and government. And all of this comes down to two drivers. Number one, the desire for control over people's lives on the part of politicians, primarily politicians who are Democrats, because their restrictions tend to be far more severe than they would be in an American country like a state like Texas or something. And the other part of it is we have to just get to the place where we're adults enough as a nation, as we used to be, to say that life does not owe us a death in bed at 103, surrounded by our families as we peacefully drift off to sleep, and everything else is a preventable tragedy. That illusion has been generated by the success we've had medically and in terms of our prosperity, and it's an illusion, and it's a dangerous illusion, and it's time we grew up and understand, there's a new way to die out there. It's not terribly dangerous, and it's especially not terribly dangerous to the people who we need the most, young, healthy people. But it's there, and that's that. And let's take the precautions when we can, but let's, for God's sakes, not hang ourselves and kill the entire populace through starvation or unemployment because of a disease that is far, far more likely to attack the extremely old people in nursing homes who can be protected and should be protected. I've never said we should let these people die. But where's the reality? Where is that silver trumpet of honest to God reality? Where's that voice of somebody like Winston Churchill, who's looking at the situation in May of 1940 and says, I have nothing to offer you but blood, toil, tears, and sweat. This is not going to be fun, and it's not going to be easy. We're going to get through this and we're going to win, but we're going to take our losses. And the sooner you accept that, the sooner we'll be able to get to business of kicking these miserable Nazi bastards back into their bunker.
You know, as some of our regular viewers know, I went to college for journalism and have worked a couple of journalism jobs over the years, present company excluded. But this is just an appalling lack of context on the part of almost every news report I ever see. Reporting numbers in a vacuum does not provide information. To say, oh, we've just reached 141,000, as if 141,000 had some magical significance. It immediately, in a natural-born journalist, which is most readers, frankly, raises questions like, hey, is anybody getting better? Is everybody who gets the infection get sick? How many people actually get sick from it? If you get sick, how likely is it that you're going to die? Did more people die this week than died the week before, or is it fewer people? And so when you see a chart like this and you see, okay, the media is reporting up, 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 but the chart from the CDC says deaths are going down, 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 down. And as Steve pointed out, you can't kind of reverse out of death in most cases, with the exception of Jesus. You don't, that chart is always going to go up. The question is kind of at what trajectory, but a more useful figure is last week, or let's say April 18th, 16,000 people died. And then the week after that, 15,000 people died. And 2 weeks after that, 11,000 people died. Those are useful statistics because what it says is, folks, it's not hopeless. We're not all overwhelmed by this. This is not going to beat us. This is not the end of America as we know it. This is not the final defeat of our country. In fact, if anything, what amazes me is that if you look at the stats from February, the number was 0 deaths per week. And then it went to 16, almost 17,000 deaths per week. And now it's back down around 4,000 per week and going down from there. What's amazing to me is that in that short period of time, dealing with a completely unknown enemy, the United States of America has somehow managed to get things under control to the extent that fewer and fewer people are dying of this disease about which we still know so little. I feel like if the mainstream media that exists today were reporting in the 1940s, we would hear news reports that would say 50,000 American soldiers just died. And then the next day, another 25,000 American soldiers just died. And then maybe a month from now, they'd say, oh, by the way, we invaded at Normandy and we're moving through France on our way to Germany. I just wanted to give you that little nugget of information. It's like, it's death without context. It's, you're not giving a sense of the trajectory. Where are things going? And are we getting better, or are we completely wasting our time? And so I'm hoping that facts like this from the CDC's website, from Johns Hopkins' website, get circulated more widely, and you don't just listen to the media, because if you listen to the media, all you can possibly think is, wow, why am I breathing my own exhaust 8 hours a day at my job through this mask if nothing's getting better? It is getting better. And there are many companies working behind the scenes right now on therapies and vaccines and ways to provide protection to the people who are most vulnerable. And people have rethought completely the process of how we treat people who are in nursing homes and in hospitals and things like that. And all of these actions are going to throw off benefits that we can't even anticipate that will make life better in other ways. It is not all negative. We are a growing, learning population, and we are going to beat this thing. And as a consequence of it, we are going to be better people for it. And we will look back on this and say, this was another of America's finest hours, despite the nattering nabobs of negativism, as I believe Spiro Agnew referred to the media. Despite all that, we were able to triumph because of the goodness and the ingenuity and the entrepreneurial spirit of the American people. For Bill Whittle and Stephen Green, I'm Scott Ott. Thanks to the members at BillWhittle.com for making Right Angle possible.